Now, if you've been dealing with chronic back pain, then you may have considered surgery to gain some sort of relief. But today we're joined by Dr. Alex Bingham from Novocur Pain Management Clinics to talk about our options, because it may not always be the best first step to go seek out that surgery. Nice to see you.
Hi, thanks, Stephanie.
When we talk about back pain, we've talked about it before. We're talking about people that are really living with so much pain.
Yeah, and so a lot of them, want to skip some of the intermediary steps, some of the things that are simpler that might resolve their pain, and they just want to get rid of the pain right now, and they jump to surgery. Unfortunately, a lot of the people that we see at the Novocur Pain Management Clinics are people that have already had surgery, but they're still in pain. And so there's this whole diagnosis, this whole segment of people, and the diagnosis is called failed back surgery syndrome, FBSS.
There's an actual syndrome.
There's an actual syndrome, and the incidence or the rate of failed back surgery syndrome is fairly high. So a lot of people that already have back surgery end up having a second or a third surgery because the original surgery wasn't able to resolve their problem. And sometimes the surgeries are never able to resolve the problem, even if they've had multiple surgeries. So it's always best to try and utilize all of the more conservative aspects that are available to you before you finally opt for the surgical procedure.
Now, what are some of those common surgeries that way maybe people at home can go, yep, I've done that one.
Yeah.
I've had that one.
Yeah, I thought maybe we'd just talk about the three most common surgeries that people are probably going to be talking about with their surgeon. And the first one is going to be what we call a laminectomy. And this is one of the most common ones. And basically, this is going to be if somebody has pressure on their spinal cord or on their nerve roots, perhaps from degenerative changes, perhaps from disc herniations, and basically what they do is, here's a view of the lumbar spine and our low back. They're just going to remove large pieces of bone from the back side of the spine, and they're just going to leave it that way. And this helps to decompress the nerve tissue. It gives it more room to exist. Unfortunately, with all of these major types of surgeries, the most common failed back surgery syndrome that we see is persistent nerve root problem, which is what this is trying to solve. They still have nerve pain.
They have space for it, but it still hurts.
Right, but it still hurts. And so unfortunately it doesn't always resolve the problem. The other thing is that sometimes they're able to resolve perhaps the radiating leg pain that is associated with it, but they still have the back pain. Now, the second one of the other most common surgeries that we see is called a discectomy, and this is almost kind of a blend between the first one that we talked about, where you have to remove some bone on the back side of the spine in order to have access to get to where a disc protrusion or a disc bulge will be, and they'll insert an instrument in there and they'll basically just clip away the bulging or the protruded part of the disc, because that can be a very painful situation as well. And then the third most common type of surgery that we see is called spinal fusion. A lot of times this is a last resort type of surgery where they really don't know what's causing the pain, and they are going to they'll take pieces of bone from your pelvis, from your hip area, and they will basically create a bridge between two different levels in your back, and they will try and graft bone into that area to fuse the two segments together, and then a lot of times they'll use hardware to further reinforce it. Unfortunately, a lot of times the bone graft doesn't take. A lot of times the hardware that we just looked at fails or breaks, and a lot of times it just doesn't resolve the pain problem again.
That makes me feel so terribly sad for these people that have to, I mean, those look so, it's just a picture and it looks so painful. So if that's not going to work, then what is your recommendation?
Yeah. Well, you definitely need to exhaust the interventional pain management procedures that are available. Once you've exhausted more conservative care, chiropractic, physical therapy type things, and if that is not adequately resolving your pain, you need to really exhaust the pain management interventions that are available, and that has advanced so much just in the last 10 years.
Well, I mean, we've even talked about, advancements like your pain pause, technology.
That's right.
So how does Novocur really provide the best resource for people in the Valley to go and try these methods that you're talking about?
Novocur, we offer some proprietary treatments that really nobody else is able to offer, and part of it involves the medications that we utilize to inject. We have a non-steroidal actual medication that has absolutely no steroid, and what that allows us to do is it allows us to inject much more medication into more areas of the spine without being afraid of the consequences or the negative side effects that a steroid often is associated with. And because of that, because we're able to inject so much more tissue, we are able to help a lot of people that have perhaps already tried pain management procedures, injectable procedures, and it wasn't able to help them. We are able to help an awful lot of those people when they come to Novocur because of the methods and the medications that we are now utilizing at Novocur. Really has opened the door to a lot of people where previous things have failed. We're able to help them out.
Well, I think that's good news for a lot of people, and even if you think you've gone down the pain management road, we would just encourage you to revisit it, because obviously there's a different, unique way that Novocur is approaching this.
Yeah.
And here's how you can take the first step. Novocur Pain Management Clinics have 2 locations in the Valley, and for more information you can visit Novocur.com or call them at 480-855-NOVO, which is 480-855-6686.